So now we've got a brief panel discussion. So I'll ask Sarah to join me and hopefully everyone will be on screen. Maybe I'll start with you, Sarah, since you're here in the room with me. And the first question is from Anonymous. Should we be including sustainability units for nurses, doctors and allied health professionals as part of their university degrees to provide transparency and a base for better practice?
Okay, well, there's a lot there to unpack. I think absolutely educating the new generation of climate champions that are coming through is absolutely critical. So building, I guess, that knowledge of sustainability and healthcare, climate health concepts, planetary health concepts into the undergraduate and postgraduate curriculums is really, really important. I think there was almost a second part of that question, which was, I guess, was around having almost sustainability leads or teams within different clinical professional kind of portfolios. And again, I think that's really important. And I think, we've seen how well that's worked here in WA, for example, at South Metro Health Service, where they've recognised the need to have that clinical leadership and they have those roles. Emma-Leigh, I know you were in it previously, and now Adam Crossley, in terms of having that clinician leading those conversations with other clinicians about how they can be more sustainable. But also, I think Jen Bardsley's in the room somewhere from the nursing side of things, out there on the wards talking to nurses about the things that they can be doing. And yeah, absolutely think it's really important to have the clinicians leading those conversations.
Fantastic. Okay, so the second question, I might direct this to Vicktoria if she's, yes, joining us. Hi. The Anonymous writes, I think it's important to embed First Nations people's self-determination in healthcare, climate change, adaptation and mitigation. Do you have any pearls of wisdom how we approach this or how we do this?
Kia ora. We're really lucky in New Zealand because we have Te Aka Whai Ora, which is the Māori Health Authority. So that authority has been set up to basically lead on health solutions for Māori and Pacifica in Aotearoa, New Zealand. So we're quite advanced in ensuring that the voice of tangata whenua or Indigenous communities are held as part of our decision making and healthcare approach. I think it sort of links to the broader conversation around collaboration and coming together for climate action and finding solutions. So it's really ensuring that we're connecting and we're listening and that we're not using science as the only form of wisdom for the solutions that we require. So there's plenty of opportunity. I think it's likely quite different here in Aotearoa, New Zealand, where we have quite a bicultural society as a general rule. We are moving towards being a lot more bilingual. We do have a lot of the Māori culture or tikanga in our general day-to-day, so it does make it a little bit easier, but it is about conversations and ensuring that we're listening to the voices of our communities, of which our Indigenous community is a significant part.
Thank you. Yeah, important that we all acknowledge that necessity to walk together. The last question I'll throw out to the folks at New South Wales. So with the growing substitution of reusable devices with single-use medical devices being one, what assessment tools are available to measure their sustainability impact? And we saw that you did quite a large amount of footprinting over there. And did you look at this and do you know of any tools available?
Kath, I'm not sure if you have any further insights than me, but no, we didn't look at this in particular. We were looking at our footprint overall in general, but we didn't go into particular medical devices. Kath, did you have any further thoughts on that one?
Yeah, so I think, like Nicola said, we didn't dive into that sort of granularity to do a carbon footprint, and the medical devices was often used financial spend data. However, I think this is a space where there is a lot of questions coming up, and the transition away from the single use back to sort of the way things used to be done is certainly a trend. And I think there's a significant number of initiatives across New South Wales Health, and probably broader than there and across Australia and internationally around looking at the life cycle assessments of these pieces of equipment. So I think whilst there's a number of initiatives, it's not something that we looked at specifically, but certainly within our districts, there's a lot of initiatives happening. So if people have specific things, I think it's great to connect and to share the learnings on those life cycle assessments.
Yeah, fantastic. There's a follow-up question here in regards to that. Somebody has asked if there's any chance you're willing to share your net zero pathway work with other jurisdictions.
Yes, of course. I think this is something that anyone doing work in this space should be willing to share. Our emails were in that last slide. Very happy for people to reach out to us, and we're happy to share any knowledge and join forces wherever we can.
Fantastic. We're going to have to call it there because we're a little bit over time, but really wonderful conversations this morning and rich information that we can all go away and ruminate on or meditate on as we enjoy some morning tea. So everyone just join me in thanking our 3 speakers this morning.